Welcome, everyone. We are going to start the regular meeting of the Health, Mental Health, and Education Committee. It's 10:33, and we're in City Hall Room 1010. We don't yet have a quorum, but I am joined. Oh, we are going to, and we have a quorum. We are joined by Councilmember Mitch Englander and Councilmember Joe Buscaino. And I'd like to remind those who want to speak on any of these items today to fill out a general public comment card and bring it up to the officer at the front. And I'd like to open it up for public comment at this time, and seeing that there is no public comment cards at this time. No one wants to speak, right? Public comment? I'm going to close public comment, and we're going to move to item number one. Mr. CLA, can you read in item number one, please?
Good morning, Brian Randall, Office of the CLA. Item number one is a City Administrative Officer to report in response to Council action of September 30th, 2016, relative to the feasibility and legality of establishing a child savings account program in the City of Los Angeles.
Thank you. Colleagues, this item is the Children's Savings Account. Last item, we heard it, we were expecting a written report this month, but I'm told by the CAO's office that they are very close to having it done. So today, I'd just like for the CAO and the CLA to provide us with a progress report, and I'd like to confirm that a written report will be ready for us to review by the first meeting of the new year. And I believe the CLA wants to go first.
Thank you. Our office was instructed by Council to assist the CAO in the preparation of the report. I can provide a brief overview to start and then let the CAO provide the remainder of today's report. This item was initiated on September 30th, 2016. The City Council approved a motion, Rue, Wesson et al., to instruct the CAO, with the assistance of our office and the City Attorney, to report on several items regarding the feasibility of instituting child savings account program in the City of LA for Los Angeles Unified School District students. The instructions were as follows. The feasibility and legality of establishing a children's savings account program in the City of Los Angeles. Program background, including an assessment of the structure of programs in other jurisdictions. And prepare and release a request for information from interested and experienced financial institutions and interactive banking platform developers regarding the scale and any matters as appropriate. The CAO was further instructed to report, with assistance of the Housing and Community Investment Department, on staff and resource requirements for the development of an LAUSD-wide program. As instructed, the CAO, our office, the City Attorney, and the Housing and Community Investment Department have met on several occasions to discuss the feasibility and legality of instituting a CSA program in the City of Los Angeles. In addition, we have engaged in discussions with the County of Los Angeles and the Los Angeles Unified School District. We have received enrollment data from the LAUSD, and the school district staff have been very helpful in that regard. We have also consulted with representatives of various agencies with expertise on CSA programs, such as the Corporation for Enterprise Development, known as CFED, to obtain additional information for preparation of the report. To provide some background information on child savings accounts, in the jurisdictions that they've been established, they are automatically open to new kindergarten students with an initial deposit, often $50, to be used for post-secondary education expenses. There are also various incentive opportunities, such as attendance. The program has been established in several jurisdictions in California and the U.S., such as the cities of San Francisco, Oakland, Boston, and the states of Indiana, Nevada, and Oklahoma. There are varying structures to these programs, but in general, families enrolled in a CSA have sub-accounts with their kindergartner as the designated beneficiary. Instead of social security numbers, student ID or other forms of identification are used. All deposits and matches can be viewed by families on an online system. Funding sources also vary. San Francisco uses a combination of city funds, foundation support, and individual donations. St. Louis, Missouri uses fees collected from parking revenue, individual donations, and support from corporations and foundations. New York City's program, which was announced a few weeks ago in November of this year, is being funded by a $10 million private donation. And research conducted by universities, research organizations, and others suggests that these programs can expand educational and economic opportunity for low and moderate income families and increase the likelihood of attending college. Much of the potential benefits of these programs are set forth in a book written by Michael Sheridan called Assets in the Poor, which advocates providing savings accounts with subsidies to low-income families who may lack access to financial institutions. That concludes our brief overview of this item, and with that, I will turn it over to the CAO's office to provide the remainder of today's report.
Thank you, Mr. Randall.
Good morning. Emily Zan Cervantes from the Office of the City Administrative Officer. In addition to what Brian had mentioned, we have been, again, reviewing the structure and variation of CSA programs in comparable cities and jurisdictions and assessing the positive and negative attributes of various programmatic options. He gave a very good detailed list of the various jurisdictions, and I wanted to add that we've also been looking at Boston, and they're starting off with a pilot program, and they are receiving funding from a foundation, which is different from the city of San Francisco and St. Louis, which uses general fund money. We are also determining the potential costs associated with implementing the program based on the Los Angeles Unified School District enrollment data, and we've received data regarding enrollment district-wide within the city of Los Angeles among kindergartners, first graders, non-charter schools, as well as charter schools. I do want to note that implementing this program is a policy decision for City Council, and if city funding is used for seat accounts and/or administration, it will likely have an impact on the general fund.
Great, thank you. And I just wanted to check in today and thank you. And colleagues, if you remember, this is it works. This works. This is a proven program. We will not be the first, but we will be the first large city to implement this. I'm very excited about this. And actually, we've been getting tremendous amount of excitement and support from not just the LAUSD, but from the county, and Supervisor Mark Ridley Thomas is interested. There are so many partners. So I am very, very much looking forward to the January's written report, so we could push this along. And colleagues, do you have any questions?
Thank you, Mr. Chairman, for your leadership on this. I know this was something that you looking at pushing for upon arrival to the City Council, so I applaud your efforts in looking out for our students throughout the City of Los Angeles. Question on the funding. What is the feasible range of funding per pupil by the time the kid graduates high school?
Are you
As far as contributions, do we...
you mean the city's contributions
Yes.
to individual accounts? So we are looking at various how other cities structure it. Usually for the other cities, they'll start with a $50 or $100 seed account.
To begin with.
And then they may have additional incentives for those who either deposit money into the account as well, or if they meet attendance benchmarks or grade benchmarks. And in New York, they estimated a 4.5% interest rate. And so in New York City, for 12 years, starting with $100, they estimated it would be $475 maybe if they didn't add a lot to it, but that's what they estimated. And research shows that with as little as under $500 within your savings account, it already increases graduation rates and attendance to college.
Sure. Amazing impacts. And for those children who are enrolled with the school district in lower income neighborhoods, will they be receiving higher percentage of funding, do we know?
For the city, that is something that is to be decided by council, and one of the things, yes,
okay.
That is one of the options. It could either be a universal program where everyone receives initial amount regardless of income, and then some cities have done that. San Francisco does a universal program, but has an additional incentive for lower income.
And the other cities that have adopted this similar policy, can you identify the nonprofits that they've partnered with?
In Boston, they have partnered with EOS Foundation, and their mission is to break the cycles of poverty by investing in children. So it's usually very local, and in New York, it was a private donation.
Thank you so much for your report. Thank you, Mr. Chairman.
And thank you, Councilman Buscaino. And as you can see, there's lots of interest. And this report that's going to come up is going to address all of that. and because we're the first big city, the initial starting account, whether it's $50 or $100, we got to decide that. We have to decide, do we want to use city funds, or do we want to have private donors give a donation to us. I mean, there's other cities, other states have done different multiple options where some use local dollars, others use completely fundraised dollars. So these are the decisions going forward, what makes sense for us. And once this account gets started, and this is, I'm sure, all the report will encompass all of this, and we have representatives from LAUSD and everyone else. Once it gets started, there's all these other opportunities later throughout the years for other banks or other institutions or other organizations like our very own YIP here locally, or YPI, I'm sorry, YPI, YPI or the YWCA, who already has a similar type savings accounts, and they could give matching. There's lots of nonprofits and profit organizations who give matching to students who have these children's savings accounts. So these are, again, all these options are in front of us, and this is where the policy decision making we have to make. But that's why we're so much looking for this very comprehensive report that we're going to get in January. So thank you. And I just want to, for the record, we have 2 letters of support from Cal State University Los Angeles and the Los Feliz Neighborhood Council in support. Great. And we have 1 comment card. Can I have Marcus Rodriguez from the Los Feliz Neighborhood Council?
Yes, sir. Thank you for your time.
2 minutes.
Definitely. I'll wrap it up quickly. You have both letters of support. I have the privilege of serving for the Los Feliz Neighborhood Council and also as the Director of Government Affairs at Cal State Los Angeles. Those key partnerships that you're talking about, Councilmember Baru, we'd love to explore those further as we go down the line and definitely have that attachment. Cradle to career is what our model is at Cal State Los Angeles, and knowing the demographic of that institution, would like to be some of those voices in the room as we progress the conversation. So in offering these 2 resolutions in support, I hope that we can explore what a partnership looks like and at least bring some students' voices into the conversation that looked at this under a microscope and said this is definitely something that we'd like to see. We see the attachment to retention and graduation. Of course, looking at the graduation initiative, 2025 statewide, this falls in line with that, and of course with the mayor's initiatives, et cetera. So as we continue the dialogue, we'd love to be one of those voices in the room. Thank you very much for the hard work you've done on this initiative.
Thank you, and thank you for taking time out of your busy schedule to come out, especially with Neighborhood Council. And as we can see, everyone wants to partner. It is exciting. And seeing there's no other public comment cards, we'll continue this item until January, colleagues. No objections, we'll move that unanimously. Item number 2, Mr. CLA.
Item number 2 is a presentation by the American Diabetes Association regarding diabetes in Los Angeles.
Thank you, and I've had the pleasure of attending a few research-oriented events held by the American Diabetes Association and wanted to invite them here today. They'll be providing us with an oral presentation and a PowerPoint on what is potentially the greatest health challenge in Los Angeles. I hope we can walk away today from today's presentation with some ideas on how the City of Los Angeles can help with this public crisis. And I'd like to invite Julian Dillon, and Donna Lieberman from the American Diabetes Association to the table for the presentation.
Good morning, and thank you. And thank you for saying what you said. I think that we're all here, and we all do what we do because we care about our communities, we care about our children, and we care about the future of our children so that there is a future here. And thank you for understanding and knowing that diabetes is the #1 health crisis of the 21st century. And I hope that I'm going to be here today to ask you to help us as we can help you and the City of Los Angeles and all the constituents with something that I find very exciting. It's why I joined the American Diabetes Association 11 years ago. And so we are going to be piloting something in the schools, and I'm hoping you'll help with LAUSD. The American Diabetes Association has been around since 1940, so we're in our 76th year. We're the leading authority on diabetes, a nonprofit authority in diabetes in the world. We're the only diabetes organization that raises funds, and I'm not here to ask for money, by the way. But
Trust
we're the
me,
only.
our colleague does.
I was going to say, and Mitch will attest to the fact that that's very unusual for me.
I've already hit them all up.
Yeah, he's got it covered.
I'm on it. And just for those who are listening, because this is sort of off topic, and there are a lot of people that listen to these meetings, I have been on the board and active in ADA for about 21 years now.
Yeah.
And successfully have one of the largest co-host one of the largest dinners in ADA. In fact,
The most must-attend.
the must-attend dinner
Most attend.
with one of our roastees and honorees on this committee. In fact, and took a big hit for the ADA. So yes,
Then we have to get David to that, right?
I just got here.
You'll be on it.
he's targeted.
So, going back to the American Diabetes Association just a little bit, because I know you know how much we admire the organization. We wouldn't be working for it. You wouldn't be working with us for that. But we are the only nonprofit that raises funds for all types of diabetes. So it's type 1, type 2, gestational diabetes, and also what we want to raise funds for and talk about are caregivers. We raise funds for research for the cure, but we also raise funds for the deadly complications. We raise funds for and provide free and credible information and education for the community. We are also the only diabetes nonprofit that has a full staff of advocacy, so we advocate. We feel that no one should walk alone with this disease. That being said, I am hopefully going to be able to know how to work this. So diabetes is, which I said, is the most socially health concern of the 21st century. So these are nationwide figures, and I put them up here because it's important that you know where we are in relationship to Los Angeles. 1 in 11 Americans grapple with the disease every day, but in LA it's 1 out of 10. So actually 10% of our constituency already has been diagnosed with diabetes. That's nearly 30 million people nationwide. Another 86 million are at risk. It's the 7th largest cause of death in this country. In Los Angeles, it is number 5. On a national basis, it's $322 billion a year, and that does not include gestational diabetes. The 86 million people that have prediabetes, and there's 90% that know. And why this is so concerning is because the longer that you have the disease and you are not managing it properly, the more difficult and the earlier onset are the complications, which are very deadly. And of course, prediabetes can lead to type 2 diabetes. 1 out of every $5 in healthcare that's spent on healthcare is for diabetes and its complications, which means that it's 2.3 higher. People spend 2.3 times more money when they live with diabetes than when they don't. Diabetes kills Americans every year, and diabetes kills more people in this country than breast cancer and AIDS combined, which I think is a statistic that very few people understand and realize. Every 23 seconds, someone in the United States is diagnosed with diabetes. So we've had several people diagnosed in this country just in the few minutes that I'm already speaking to you. 1 in 3 children are overweight today. That is one of the leading high-risk agents to a precursor to diabetes. Because you are overweight does not mean you will get diabetes, but it certainly puts you at higher risk. Children, 1 in 3 kids are overweight. That trend is growing. Habits, we all know that habits that are formed earlier in life are easier to maintain the rest of your life. Research show that parents will actually pay attention to their children when the children introduce good health habits. If we don't address this right now, who's going to? And truthfully, what I'm proposing, which is called ADA at Play, is a new and fresh approach. We have Dr. Leonard Epstein, who's an expert in the childhood obesity at the University of Buffalo. The important thing, and I'm going to try to be very respectful of your time and everyone else that's here to speak with you, but the important thing to notice in this research study is that 40% of the kids who worked with their parents had maintained a weight reduction of at least 20%. Even if parents went back to their original weight, 40% of those kids did not maintain their loss. Creating healthy habits takes work for children and their parents. The important thing here is I know that there's a lot of talk right now, but it's been shown that it takes at least 9 to 15 times for someone to actually learn it. This is referencing to vegetables and fruit. When you introduce a fruit or vegetable to kids, you probably have to introduce that to them at least 9 to 15 times before they're actually going to like it. The increase in type 2 diabetes in children has increased 35%. That's by the CDC report. Childhood obesity rates have been tripled over the last 4 decades. Now, what I think is very important for everybody to hear is that prediabetes is also, which is the precursor to type 2, is also at epidemic proportions. In our country, there are the average of prediabetes is 33%. In Los Angeles, it's 44%. If you couple the 44% that have prediabetes with your 10% that have diabetes, that is well over half of our constituency is living with diabetes. So if this doesn't make everybody sit up and realize that we have to start this, this is the first generation of children from the year 2000 forward where parents are more likely to outlive their children because of death and diabetes. There's 33% in the younger generation that have that are living with prediabetes, and the reason why this is really concerning is because the longer they live with this disease, they are more apt to get complications, and children that live with diabetes, their complications are much more difficult. So we all know diabetes is a huge problem, so now what? To give you a little background on ADA at Play, the American Diabetes Association in Los Angeles had our first 2 diabetes prevention type 2 camps this year. And they were weekend camps. One was a day camp, but the parents it was mandatory that the parents came the second day. And the second was an overnight camp where it was mandatory that one or more of the parents attend the whole weekend. What I think is really important to let you know and why we are ready to take the next step is that we just had our 3-month follow-up, and the aggregate camp results are that after 3 months, the children on average lost 3.44% of their BMI, and they lost 2.95% in their waist circumference. We don't do weight with young children because it's not fair, because they're growing and they're going to gain weight, so we do BMI and waist circumference. So with those results, after 3 months, and then we will do a 6-month check-in and a 9-month check-in, and 12 months is they can re-up for camp again, 100% free. What we feel is important, if we have those results from a weekend camp, think what we can do if we go into the school system. And so that's what I'm coming to you to ask for your help, is to help us pilot this, not in all of LAUSD, but if we could get into a district and do our first pilot program to 4th and 5th graders. This is in the infancy stages. It is being done in other cities and states, which I can fill you in on at another time if you'd like. But we really would like your help there because it's not so easy to get into LAUSD. We have had success with training 600 nurses at LAUSD and Safe at School, so we would like to enlist those relationships already, but we certainly would love the City Council to help us here. So the pilot is, as I said, between, we could do 4th and 5th graders, depending how many schools we do, we could limit it to 4th graders. What we want to do is address healthy eating and active living, introducing more activity in a fun and impactful way, and to also have a record of impact at the end of this so that we can broaden this out to possibly all the schools. At first I was going to ask about doing an after-school program, but I didn't think that's fair because I think all children should be able to attend this. The goals are going to be to educate, healthy eating, active living, building awareness about the effects of living a healthy life, and improving access to nutrition, education, and fun activities, and of course then bringing in the factor in engaging families. Program would consist of, as we said, 4th to 5th grade focus, 8-month timeline. Every child would receive a wearable step tracker so that we would be able to have a record of impact as well as an evidence-based program to move forward on. There would be monthly defined curriculum, again, curriculum to focus on nutrition and physical activity, but again, in a fun way. For instance, if you're talking portion control, we have a game along with education that's called Portion Distortion, and it's phenomenal. We have relay races that have to do with sugar and sugar content. That's almost like a go slow, go sugar. We would have incentives. The program is set up with kiosks in each classroom. Again, this is in the infancy stages. Every city will have to change this. We actually have somebody working on a scannable opportunity where we would not necessarily have the kiosk. We could have challenges between all the classrooms. And then, of course, we would want the parents to come in. We would have pre and post testing and then have the record of a BMI or waist circumference. Curriculum, we would introduce and to teachers and or nurses. So it would be a train the trainer program where we would go in and give all the materials to the schools for free. We would talk about health and wellness. We would do a pre-test and a diabetes 101. We would then get into get moving, wearable activation with the students. We would talk about healthy eating demonstrations, introducing new foods, talking about portion control, not giving up the flavors that you love, how to go into a restaurant and make healthier choices. Again, we don't ask people to give up the foods they love. We ask them to make healthier choices and talk about portion control. Again, here we go. Portions, rate your plate, how to create the healthy plate, healthy activities, how to involve the whole family, and we want to have a post-test. We want to have a healthy celebration, and then we want to bring everybody back a month later. Any questions on this at all? Very brief.
We do, but we'll wait.
Yeah. So what I thought would be interesting, and I apologize because I couldn't find information as far as district levels for the city, so I was able to find information on prediabetes from the recent UCLA study that was also in the LA Times by SPA. And then if in fact we can do this and pick a particular district, I will go back and find out all that information for you if you don't already have it. But as you can see, there's an average of 44%, and as I said, coupled with the 10% that we have in LA diabetes, that's over 54%. Together we can stop diabetes and make wellness a way of life. There are a couple of other things that I wanted to speak of as far as our wellness platform, but due to the time limits and being respectful, I'm going to end there.
Thank you so very much. That was so informative. I know my colleagues have a couple of questions too, but your ADA at Play, your pilot project. So how are you funding that?
So this is all new.
Mm-hmm.
Okay, it's based on our camps. So we are taking our programs that we did at camps,
Mm-hmm.
and now there are 8 cities that are going to be doing ADA at Play or a form of it in 2017.
So you guys are fully funding all of that, right?
No, we're going to be working on that. And I have already people that I'm speaking to,
Mm-hmm.
but I felt that the first step would be to come here and to see if in fact we could. Some of the cities are funded, so there are natural progressions to those same organizations that are in Los Angeles.
Okay. And you know, LAUSD was here just earlier, but they left for the children's savings accounts. But I mean, I'd love to take up your offer and have the pilot project in the schools in my district. My staff could talk with you afterwards, and I wanted to say it first before my colleagues could jump in. So, but I would love that. And also,
love that.
yeah, and if you stick around for item number 5, we're going to talk about the city's wellness plan. So I think this is exactly in sync with what we're trying to do in the city of LA as well. So if you stick around for that, you could meet with city staff because I think it's the same end goals. But I'd love to follow up with you on that, and thank you for this wonderful presentation.
And I thank you, and I hope you'll let me come back and talk to you about using some of our wellness platform,
Yeah.
which we've done for active living, for National Healthy Lunch Day. Mitch O'Farrell did a dance a couple years ago on the City Hall.
Right.
So I would love to be able
Yeah,
to.
so I don't want to preempt number 5, but I hope we're already doing that or we're trying to make those connections.
Okay.
I want to open up to my colleagues if they have any questions.
Thank you. So do I do anything here?
No. Great. Thank you so much for that. And seeing that there is no comment cards, right? No comment cards, right?
If I might, I just want to thank you, if I can, Mr. Chair, and recognize the work that AD is doing in our city and thank our colleague, Mitch Englander, who leads the fundraising effort each and every year, because without Mitch's commitment to the ADA, we wouldn't be able to fund these types of camps and programs that you're presenting here. Though I was the butt of the jokes this last go-around, and I mentioned at the event that, my grandfather died of type 2 diabetes, and diabetes has no borders. I have uncles in Italy that also have diabetes as well. So thank you so much for the work that you do on a daily basis. And those slides clearly remind us that a lot of work needs to be done. So thank you. Appreciate your commitment.
I appreciate it. Thank you.
Thank you, Councilman Piscano. And I concur with him that because of Councilman Mitch Englander, I think diabetes is probably amongst the city family the most well-known for all his work and efforts. So thank you for that. And seeing there is no comment cards, we're going to move this oral report. And there's no, so we'll move to item number 3. Mr. CLA, can you read that in, please?
Item number 3 is a city clerk report relative to the annual reporting of Anti-Smoking Trust Fund number 41Z for fiscal year 2015-16.
Thank you. And this item is the last report of the Anti-Smoking Trust Fund, and I wanted to remind everyone of the great work that we did last year on this. Last year, we passed a smokeless tobacco ban in Los Angeles sports facilities and moved the remainder of the funds in this trust fund to recreation and parks so that they could put up signs in our city parks to advertise people of the new rules. I just wanted to bring this up in case if any of the colleagues had any questions, but if you guys don't,
I'm good.
We'll just pass this. Unless CLA, RAP, or City Clerk, do you have any pressing you want to mention in it?
No further comments on this item.
Great. And there are no comment cards, so we will pass this unanimously. And item number 4.
Excuse me, just for the record, you wish to note and file the report?
Sorry?
For the record, you wish to note and file the report?
Yes.
Thank you.
And item number 4. Mr. CLA?
Item number 4 is the Los Angeles City Health Commission communication relative to a recommendation that the City of Los Angeles continue contracting with the County of Los Angeles to enact enforcement and implementation of the health code.
Thank you, Mr. Randall. And this item was transmitted to us by our City Health Commission, and I believe the Commission Vice President is here. Can you please come up to the table? I know this is something that we do every year, but if you could please explain this item and your recommendation, please.
Thank you. Good morning. Thanks for the opportunity to join you. Matthew Sharp, Vice President, Los Angeles City Health Commission. To be brief and concise, there are 52 years of history that can be summarized in a handful of sentences. 52 years ago, the city established a contract. We found a copy of the original paper agreement to transfer oversight of what's called the Public Health Code to the County of Los Angeles. The universe of functions at that point was much smaller and more discrete than the very complex world of health services and health functions today. And so the ordinance that required or requires your council to annually approve this may have been on a premise that there's a wider range of functions involved. The Health Commission took a careful look at that in consult with County Public Health represented here today. If you have any questions from their standpoint by Joshua Bobrowski, the methodology was to take a look at this, contact a variety of experts, devise a survey of city departments, solicited input from general managers regarding whether they had concerns with the county's performance of its functions in the health area. We even explained to them a little bit about what that involves. Received no concerns. The commission deliberated, determined that it was in the best interest of the city to continue this arrangement, and as I think we'll discuss a little more about in the subsequent agenda item on the Plan for Healthy Los Angeles, to deepen the coordination between city and county government will lead to healthier neighborhoods and healthier environment for Los Angeles residents. So it's our recommendation that you all proceed with this and adopt it as we've advised.
Thank you, Mr. Sharp. And I just want to take this time to recognize the tremendous work that you do over there, and the amount of my office has only had great things collaborating with you. And thank you for your leadership in the newly formed Health Commission. And thank you for that very brief, concise report on this. Colleagues, any questions?
Great. Thank you so much. Thank you for your time.
Thank you. So seeing no public comment, we will move to approve this recommendation of the Los Angeles City Health Commission to continue to contract with the County of Los Angeles to enforce and implement the County Health Code. Seeing no objections, we'll pass this unanimously. And last item, Mr. Randall, could you read that in, please?
Sure. Item number 5 is motion Rue O'Farrell directing the Planning Department to report on the status of the Plan for a Healthy Los Angeles, next steps, resources needed, and any unresolved issues related to the implementation of the plan. This matter was also referred to the Planning and Land Use Management Committee.
Thank you. This motion asks the Planning Department to provide us with an update of the plan for a Health Los Angeles, what has been done so far, and what steps come next. I think this is a very important, this feeds into what we just had the presentation with by the American Diabetes Association. And I'm very excited about this report that was done in 2015. So, representatives from the Planning Department and the Community Health Coalition have come forward. If you could introduce yourselves and present.
Good morning. Claire Bowen, Los Angeles Department of City Planning. I'm really, truly pleased to be here today to share with you a bit more about the health plan. Obviously, addressing health issues really requires multiple collaboration across different departments as well as other agencies. I'm actually very pleased to be joined at the table today by Gwendolyn Flynn from the Community Health Councils, as well as Aisha Seiler from the LA Food Policy Council. I also wanted to recognize Joshua Bobrowski from the LA County Department of Public Health, as they were a key partner in the development of this plan and in many of the implementation strategies we've been working on thus far.
Is there a fourth person? Do they want to come up too?
Joshua wants to sit on there. So the plan, as you mentioned, Councilman, was adopted on April 1st, 2015. It was launched in 2012 with a grant from the county that they got from the Center for Disease Control, and we were very pleased to have a consultant help us with that effort, Ramey and Associates. The health plan is a part of the city's general plan. It's not a required element. It was kind of a voluntary element we took on because, again, the city recognized the value and the importance of really highlighting the health issues that face our city. So I wanted to take a moment first to just kind of refresh you as to what the health plan does and what are some of the issues and concerns that were raised during the development of the plan. The plan really highlights 6 different goals. It really puts an understanding and emphasis on understanding the impacts of the built environment on health. It emphasizes the importance of the various issues that are environment. Read my notes. Emphasizes the importance of and understanding the environments that the environment is free. The importance of having an environment that is free of environmental hazards and toxins. It highlights the value of education throughout one's life. It puts a priority on providing neighborhoods that are safe and emphasizes the importance of parks and open space, emphasizes the role that food and production plays in nourishing our bodies and the environment, and highlights the critical need for all Angelitos to have access to medical care. During the development of the plan, one of the first things that the consultant did was put together a map atlas. It's a large document, and it really highlights the many disparities that are throughout our city. Just as I want to just highlight a couple of the issues that it brought up. The map atlas put together what they call a hardship index that looked at such indicators as overcrowding, poverty, employment status, education, age, and income, and it showed how those indicators have affected different parts of our community. So, for example, the Southeast LA area has the greatest level of hardship. So again, these issues are felt by different parts of our community differently. It also highlighted the life expectancy, for example, that someone born in the Bel Air, Brentwood area is likely to have a life expectancy of 84 years compared to somebody in the Watts area is likely to have only a life expectancy of 72 years. And I think to the point that was just raised by the American Diabetes Association, the map atlas highlights the issue of childhood obesity. And for example, a child in Brentwood has only 11% risk of obesity, there's prevalence of childhood obesity in Brentwood is only 11% compared to the prevalence of childhood obesity is 30% or higher in such neighborhoods as Boyle Heights, Harbor Gateway, South LA, and Southeast LA. And perhaps maybe we should be taking a look at that map, maybe when we work with our partners after this meeting to talk about maybe where would be the best school to really use some of this data to figure out where we can have the most impact. So moving forward, the plan put together 88 programs, and while there has not been the opportunity to specifically have a staff person in our planning department dedicated to working on the health plan, there's a lot of efforts we've been doing. One can actually argue that a lot of the role of our housing team in our planning department is very much focused on addressing health issues, because we know that 1 out of every 5 households in the city of Los Angeles is overcrowded, and more than one-third of renters pay more than half of their income. So again, addressing housing issues, you also then deal with health issues. One of the other major initiatives that our department has taken on since this plan was the Cleanup Greenup program, addressed again, obviously, the concerns about environmental toxins and their impact on communities, and then the Quimby ordinance, which again is helping to create more parks in the city. I'm going to turn it over now for a moment to Aisha, who's going to tell you a little bit more about some of the work that the LA Food Policy Council has been doing on behalf of the plan.
Good morning, council members. My name is Aisha Seiler, and I work for the LA Food Policy Council. Thank you for inquiring about the Plan for Healthy LA. The LA Food Policy Council deeply participated in the process led by the City Planning Department to develop the plan, as we are members of the Technical Advisory Committee and the expert panel. We solicited ideas from dozens of expert food system leaders on our board and in our working groups. We were very pleased with the results of the plan, and we feel Chapter 4, called Food That Nourishes the Body, Soul, and the Environment, continues to be relevant to the ongoing multifaceted work to ensure that all Angelenos are afforded their right to nutritious, safe, and culturally relevant food. I would like to provide you with some brief updates on the work we are doing in partnership with the City of LA relative to Plan for Healthy LA, and identify a few areas where more work is needed. First, the plan identified the objective of increasing access and the availability of healthy food retail options in low-income and underserved areas of the city. To this end, in 2016, the LA Food Policy Council, through our program called the Healthy Neighborhood Market Retail Network, hosted 3 training events for over 40 neighborhood market owners operating in underserved areas, and provided customized consultation, new equipment, and marketing materials to 18 store owners who made significant changes to their store environment and business to focus on healthy food. The work is partly supported by community development block grants from the city. Of our program participants, 94% reported increasing the volume and scale of healthy food offered since participating in the program. We also co-manage a fresh produce delivery service with 2 other nonprofits called Compra Foods, and we grew the number of corner stores buying fresh produce to 32 stores just this year. 10 of these stores began offering fresh produce in their stores for the first time, adding an average of 8 new produce items, and 12 stores chose Compra Foods over their suppliers for convenience and service. The plan also discusses increasing the number of Angelenos who live within 1 mile of farmers markets and increasing the number of farmers markets that accept EBT and participate in the Market Match program. Together with city partners, we made significant progress on this issue. In the May of this year, City Council voted to create an ordinance that requires all farmers markets in the city, I think you remember that, to accept CalFresh and EBT. We contributed through extensive outreach and education, achieving 95% voluntary compliance among the farmers markets before the policy is even complete. We worked with the Mayor's Office and Councilman Weezar to host a sign-up day in May 17th, where farmers market managers could expedite and complete their application to become SNAP authorized with the USD on the spot within 2 hours. That day, we had 26 farmers markets, CSAs, and pop-up produce stands from across LA County come to sign up that day. We feel this was an extremely effective and proactive demonstration of our city leadership on this issue. We are now awaiting review by council committee, actually tomorrow, of the final ordinance in entertainment and facilities. We only have 6 markets that need to comply in the city out of 55 of our farmers markets, which is a 43% increase from a year ago. Anecdotally, we understand that many farmers markets need more support, services to remain viable fresh food outlets in our neighborhoods. We suggest the city consider increased support for farmers markets in the way of marketing and promotional materials and growing the Market Match program, which is a proven strategy for supporting low-income families' ongoing participation at farmers markets. Currently, the Market Match program is active at 29 farmers markets across LA County, and 16 of those markets are here in the city of LA. We recommend the city consider developing its own Market Match fund, leveraging USDA dollars to boost farmers and low-income families alike. The plan also speaks of increasing community gardens and urban farms, which is one way to not only bring fresh food into community in a neighborhood, but also create environmental benefit through soil building and water retention. This year, LA Food Policy focused on our efforts in establishing the Urban Ag Incentive Zone, which was established in LA County earlier this year, and we're working with city planning and city council to actually get it established here in the city of LA, hopefully early next year. We've identified 7 community gardens that would automatically qualify for this tax benefit, and we'd love to work with the city council to better identify more vacant and underutilized lots, both public and private, that would be appropriate for community gardens and urban farms. The plan also discusses the value and the need to continue to develop the city's own procurement policy for food, the Good Food Purchasing Policy, as a way to cultivate fair labor conditions and opportunities and environmental standards. In 2016, LA's Department of Rec and Parks served 200,000 free meals to youth in public parks in partnership with LAUSD on the Good Food Purchasing Policy for the 3rd year in a row. The Department of Rec and Parks also incorporated good food purchasing standards into the Greek Theater, for which we completed the first baseline assessment. The Department of Aging food contracts also incorporated GFPP standards for the first time since 2012. Additionally, LA World Airports LAWA, with more than $7 million in food contracts, adopted the Good Food Purchasing Policy this year. We are working with LAWA to analyze food supply chain practices. Lastly, the Plan for a Healthy LA encourages and promotes proactive support for innovation, food microenterprises, and low-income neighborhoods. We have consistently asserted that a permit program for mobile food vendors, including incentives for healthy food vendors such as a waived or reduced permit fee and access to vending around schools, would achieve this objective and increase the opportunity to deploy the healthy food to neighborhoods of need. In light of our recent presidential election, I should note that many food system practitioners are very concerned about cuts to the SNAP program and other funding streams for community food projects. Many innovative and important community food programs in Los Angeles are supported by federal funds, and it is critical that city leaders consider ways to defend these investments and support the lifeline of low-income families. We look forward to continue to be involved in the Plan for a Healthy LA. Healthy Plan for Health.
Great, thank you.
Can you restate your name and your organization again?
Yes, Aisha Seiler, LA Food Policy Council.
Thank you, Aisha. So we're going to conclude by telling you a little bit about another program that we've initiated as a result of the Plan for Healthy Los Angeles. It was identified as one of the 88 programs. It's called a Healthy Kid Zone. It was actually put in the plan by the community health councils, and it rose to the top when we brought together our technical advisory committee and our community advisory committee after the plan was adopted. We said, okay, we have very limited resources and no identified staff, so what do we think, what's the most important thing we want to work on? And we said, let's work on this Healthy Kid Zone idea. Let's really identify it. Let's see if we can't start to kind of figure out what we want to do and figure out how we're going to move forward. So a number of us got together, which included the City of Los Angeles, the Community Health Councils, First Five Los Angeles, LAUSD, LA County Department of Public Health, and the LA Trust for Children's Health. And we met for over a year, just kind of an ad hoc process, really trying to figure out, well, what is a healthy kid zone? What would it mean? How would we organize it? How would we structure it? So we started talking about maybe you use the LAUSD's wellness centers as you figure out which schools have wellness centers, and you use those as the center, and maybe you look at within the half mile of that area, what are the different kind of community-based programs and activities that you might want to do to really improve the overall health and well-being of communities in that area. And as a result of those conferences, we looked at, do you try to improve like the food, physical environment, transportation, access to open space, education, again, a wide, affordable housing, a wide variety of issues. As a result of these conversations, most recently, Community Health Council stepped up and said they would really be interested in kind of taking the lead to get this to the next step. Because again, we in the county and the city didn't really have any funding to actually, and staff to actually kind of make this go forth. So I'm super excited to have my colleague Gwendolyn Flynn tell you a little bit more about kind of their interest and what some of our next steps would be.
Good morning, committee members. Can you hear me? Yes. I'm Gwendolyn Flynn. I'm a policy director at Community Health Councils. We're a community-based health policy, education, and research organization located in the Crenshaw district of South LA. And we had written up a report on this notion of healthy kid zones, which I'm going to assume that most of you are aware of what that is. And Claire, in her reporting, just talked about the fact that what we're talking about is establishing a buffer, a half-mile buffer around schools that would be more conducive to healthful decision-making by students and their families and community members in that school district. And so we are, it's an adaptation of some efforts, initiatives that are going on around the country. And so we are very pleased to be able to step up and help to facilitate this process with this task force of, you heard the membership that Claire talked about. And we will be expanding that membership to include other community residents and community-based organizations. Right now, we have recently identified Fremont High School as a school that we would like to pilot this notion of healthy kid zones in. And Fremont High School was identified by the group basically because it met a lot of the criteria that we had spelled out, in that it has one of the highest fitness gram failures in the school district. It has highest rates of uninsured children and adults. And it is located in the boundaries of a medically underserved area. It carries a high pollution burden and respiratory risks and has 0 park acreage per 1,000 people within a half mile of the school. But in addition to that, Fremont High School has a very high readiness factor, as we see it. It has an established wellness center, a parent center infrastructure that we thought we could leverage, and the school administration has expressed some interest in participating in a pilot project. And so we're moving forward with that. We have recently, one of our first tasks was to identify other resources in the community that we could leverage. And so we conducted a resource landscape analysis, which we are putting the final touches on. And we are also looking around for funding. Right now, this is an unfunded project, but it's one that we feel very strongly about and care about, and will be seeking those funds. We've had recently, the last couple of weeks, had a conversation with LA Care, who has expressed an interest in funding this sort of pilot sort of planning of the implementation of HKZ. And that's what this work group is tasked to do, is to develop an implementation plan and then pilot that plan at Fremont High School. We'll be having a briefing call with our initial partners that was outlined by Claire, and that in that call we will be establishing our regular meeting and agenda, which will include the development of a work plan and the ways in which we're going to go about establishing this implementation plan. And so we look forward to expanding this work group and working with CD9, because Fremont High School is located in Council District 9, and be able to come back to you and report our progress.
That concludes our report, and happy to take any questions if you have any.
Thank you. That was a comprehensive. That was a lot, and I got the Cliff Notes for this report here. But my staff really enjoyed it and said it was amazing. So I'm going to try to do some bedtime reading with this one. But you know, the information that we gain from these efforts. So how do we incorporate it into our planning process? I know we did it for the EBT, ability to take EBT cards, but do we do anything else, or how do we incorporate it into our planning process?
I think that the health plan, the best thing that's come out of this health plan is, again, just kind of that it's raised awareness. So whether somebody's working on a transit plan or working on a community plan or even a project plan or working in an area that, I think it's really incumbent upon, my team who help put this together is to continue to make sure that people are aware of the data and the information that's in this plan. So we're constantly able to raise awareness that when we're making decisions as a city about our funding or other efforts, that we're really mindful of where are the communities that need services and amenities and funding most.
So for like food deserts, areas that are food deserts, like in South LA or other areas, can we possibly do something in the planning process where we encourage or incentivize whenever they do mixed use development there or something like that?
Right. So the
incentivize, yeah.
Yeah, that's a good question. So the South and Southeast LA community plans are, currently underway, and I know that the staff looked very hard at this issue. They were very much aware of the challenges in that area, and I believe they did build in kind of as an incentive package that one of the things you might be able to do in addition to affordable housing, if you did like a grocery store or others, you would get some FAR benefit. I don't know the details on it, I didn't work on that community plan, but they were very much aware of that, took that into consideration.
Great. Yeah, I was initially wondering why this was in planning department, but now I see the nexus. So I think I would really much support those types of ideas, and I look forward to seeing them. But one more question. Some of the elements that we talked about, how is it being enforced? I know the EBT, we worked on that recently, so I know that, but Gwen Flynn just talked about buffer zones near schools. So are we enforcing that, or is it, again, just
So the plan is just a policy document. So this idea of a healthy kid zone is simply at this point an idea, and really what we're here to share with you today, kind of what that concept is, and with the hope that our team that I elaborated will continue to work and try to further define it, work with the council office, work with other community groups to really figure out, what are the partnerships? What are we going to try to accomplish? What are the goals you're trying to improve in that area? So it's getting very much a pilot. The half mile is kind of a conceptual buffer idea. It might not necessarily be a perfect half mile. We might say, maybe it needs to be 3/4 of a mile, but it's really more just the idea. In some ways, I think of it like a mini promise zone, that you're saying this is an area in the city that requires a lot of attention for all the reasons that Gwen outlined, especially about the Fremont High School. Obviously, there's a lot of issues that need to be addressed, and the idea that instead of having organizations kind of one by one trying to work on these problems, that there's kind of more power when people work together, when different agencies and organizations are all working on their own individual things, but working towards the same end goal in terms of being able to measure then hopefully greater improvement. So that's kind of the idea. And again, she's going to try to go off and work and find more money, and hopefully by saying this is something that the city of LA is behind and the county is behind, it'll make it easier to kind of go get that funding. And again, for all those collaborative partners to be able to then individually go off and find funding because they can say they're part of this Healthy Kid Zone initiative.
So on that note, so how do you coordinate with, or who does the coordination with all the other groups? Because I know ADA is going to probably ambush you guys right afterwards and try to get involved. But how do you, there's, in LA we got healthy, all the different groups, Alzheimer's Association, you name it. We have probably the headquarters or the largest branches of every single organization out there, whether it's diabetes, cancer, lung cancer, American Heart Association, yeah.
So that's one of the tasks of the work group. And as I said, we just conducted we just finished our resource landscape analysis, which is identifying those organizations, and we're going to be reaching out. I think ADA may have been a part of that analysis, but we're going to be reaching out to them for sure, and others to see what work is being done already there, and bring them into the fold as part of the work group, so that we can have those conversations and make sure that there is, communication and coordination of resources.
I was going to say, in regards to the Food Policy Council, we are made up of several hundred stakeholders that are working on several different working groups having to do with food. So we are pretty well connected, and we're usually a go-to person for the public or folks that want to get involved with food policy issues. So we do a lot of that networking and collaborating, coordinating too, in regards to food specifically.
No, I'm very excited about this report. And is this the first time we ever did this in 2015?
Excuse me, this plan is the first time the city has done a health plan in the city's general plan.
Well, I'm very impressed by this report and very excited about it. And I'm glad. And it's funny because we're also trying to work on a wellness plan for the City of LA employees, which we're a little behind on. But we have a citywide plan, which is very exciting. And I know I'm very interested, and I know my colleagues are too, and I think Councilman Buscaino has some questions. But before I turn it over, I think this. And we were looking into this idea as well. I think this begs the question that maybe we should look into having some sort of health officer in the city of LA who could help coordinate all of this. And I know our vice president of our wellness commission, which is recently formed as well, probably same inception as this report probably. And there's a lot of things going on. So maybe some sort of health officer to help just coordinate all of this. The wellness program in the city, throughout the city, wellness program for our employees, all this coordination efforts we're talking about, coordinating with the health commission. I think coordinating with the different departments, because I am more than willing to try to see how we could incorporate because at the end of the day, environmentalism is strong, but this nexus is still a little lacking. So I think this is a great first step, and I look forward to continuing to work with you guys and getting reports from you. But I'm going to turn it over to Councilman Buscaino.
Thank you, Mr. Chairman. Thank you for your comprehensive report. As you know, I represent one of the most highly disadvantaged and impacted communities in the city of Los Angeles. Clearly noted in your report, and over the course of the last couple of years since the report was launched and completed, we're really proud of some of the work that we've done collectively with our community-based organizations and the city family. So thank you so much. You have given me and my team some guidance as to next steps. As you well know, we added 2 community gardens, one in Wilmington in partnership with the Department of Recreation and Parks, and one in Watts with Lots to Spots. We're moving forward on a clean air action plan at the Port of Los Angeles in partnership with the AQMD in preparation for next year's AQMP. The Port of Los Angeles just recently approved a bike share program that's going to add 7 kiosks along our waterfront in Wilmington and in San Pedro. Wilmington today has the largest bike lane network in the city of Los Angeles. Really proud of that. We brought one of the healthiest fast food restaurants in the city local on 103rd Street. And also highlighted, I would say, the most beautiful park in the city is Serenity Park in Watts. And we're doing more, looking at creating more green space, active space, including more skate parks and bike parks in my district. So I really appreciate that. Moving forward, I know there's a lot of work to be done. And funding is going to take, in order for us to implement more of these ideas and efforts, it's going to take some dollars. And I want to hear from you in planning, what's our goal in taking advantage of these cap and trade dollars from the state? Because as you know, cap and trade dollars are focused on impacting the disadvantaged communities at a time where we're redeveloping our waterfront in Wilmington and San Pedro and bringing more mixed income housing we just extended, or a year ago, we extended the Silver Line, the bus line, which is now a direct shot from San Pedro to downtown LA. But now, obviously, we're looking at creating more housing opportunities, and I believe the state cap and trade dollars, billions of dollars at stake here that we can tap into. What's our game plan moving forward?
That's a great question. So we did very well in round 2. Round 3 of those dollars, which for the city of LA for housing is called the ASIC, Affordable Housing Strategic something. And round 3 is going to be kicking off in June. The city has positioned itself well through basically the partnership it's developed between city planning, DOT, and the housing department, who basically work together to identify, where are the appropriate affordable housing sites. And then the key with those dollars is that they're really looking for opportunities to match affordable housing then with multimodal transportation dollars.
Right.
And so we're going to leverage the information we just learned from the challenge grant that we just launched is really provides us an opportunity then to marry ideas that the community has for traffic and street improvements then with those affordable housing projects. So hopefully those will be able to even get more money next year.
Thank you. And to our community partners, thank you for advocating and your commitment and dedication to implementing this plan is really helpful to all of us in the city. Thank you.
Mitch?
Oh, yeah, no, I didn't know what we were reading off our year in review, but I could certainly echo a lot of the things that were our year in review.
Oh, check.
As the really the pioneer and leader behind healthy lifestyles and advocating and working with our nonprofit partnerships and others, as the president emeritus of the YMCA and our partnerships with ADA and then working with all of our local schools. We've done a lot of the pilots that Donna was talking about earlier, but we did it with the after-school programs and our healthy lifestyles and kicked off a lot of those initiatives, a lot of it that came out of Michelle Obama's initiative as well in getting active. And so we ran with that, if you will. But I want to see it continue because it was really only a beginning and it was a small part of the city. So I love a lot of the things that I'm hearing, and one of the things we don't talk about is not just the cost of a life and a shortened life and all of the issues, but the loss of productivity, the loss of what that illness does in a family and to a business and to schools and to education when folks aren't healthy, and what happens when parents have to stay home with their children or worse, have to spend the time in a hospital. And so, this is something that is near and dear to my heart because it talks about not just healthy in terms of diabetes or being active, but the air we breathe, how we commute, where we live. I mean, all of those healthy communities and healthy lifestyles are so important. And I'm not sure if there's a health report card on, healthy cities, if you will, but I have a feeling we wouldn't rank very high if there were. And that's probably not going to be any shock to anyone. And we've got to change that. This is a major opportunity now with these partnerships to change that. So one of the things that I started a few years ago was a principals roundtable. And so we bring every single principal from every school, public and private, in CD12 together on a regular basis and spend hours talking about initiatives and partnerships and bringing in some of the other nonprofits and the things that we can do together. One of the things we launched last year, as an example, is an initiative called Making Movies That Matter, where we brought in over 1,000 participants showed up for the unveil, and which we had at the Performing Arts Center at CSUN. And it was incredible. We're doing it again this year. It's the biggest of its kind in the country, and we've only done it one year, and we'll be doing it again the next year. And a lot of it based on because it's making movies that matter and documentaries and things that have touched people's lives is about just that, and healthy lifestyles and healthy communities and what they mean. So it comes in different forms and fashions. Those partnerships, I like the idea of going after funds and how we can build affordable housing and all the other elements that we need to do, but quite frankly, a lot of the education, information, public outreach doesn't take any money. It just takes time and will. And so we've been doing that a lot, but we need to do more. So I wanted to thank the chair, Councilmember Rue, for his initiative in pushing the city to do more. I think what I'd love to see this committee is take on and this is going to be huge, a big ask, a big lift, is wellness programs within the Los Angeles Police Department. We have about 1,000 officers that are on either light duty or injured on workers' comp. 1,000, just 10% of the force that are at home, and at a cost of, by the way, in work comp, $1 billion over the last 4 years just in police and fire that we've spent in taxpayer funds. That right there, just alone, if we can scratch the surface of it and make a dent, not only to save so much money, but putting officers back on the street. Talk about healthy and safe communities. I mean, there's a lot we need to do there, and we'll be looking to all of you for your help and input and guidance as we start tackling those kinds of issues as well. So, thank you again.
Thank you, Councilman.
Just
you had another
on
question.
your map, how often do you all update these maps? Because it looks like these maps date from 2004, 2008, 2006, 2008. How often do we get updated maps?
So the atlas was put together as a result of the work put together for this plan. The different years you're seeing there reflect the data that was available, the data that was available at the time we did this. If we were to do a comprehensive update of the atlas itself, which we kind of highlighted some of the maps in the atlas in the plan, but the atlas itself has probably over 100 maps in different data sets. It would be a much more comprehensive. We'd have to find some additional money to kind of go into, again, those data sets and update all that. But I think there's value in doing that, certainly in the next couple of years, as a way of getting fresh information, but then also being able to do as a benchmark to see, did we make improvements, in the intervening years.
Thank you.
Mm-hmm.
Thank you, and we have thank you for that wonderful presentation, and we look forward to working with you some more. But we have one comment card from our Vice President of our Health Commission, Matthew Sharp. 2 minutes.
Take less than that. Good afternoon, almost afternoon. Good morning, Matthew Sharp, Vice President of the Health Commission. 80% of what came in front of us over the last year is in the Plan for Healthy LA. So we spent a long time thinking, talking, and deliberating about the content and the valuable updates that Claire and team just shared with us. So I have 3 specific suggestions for you to consider in the report back process that you're engaging in with the department and with the Plum Committee. The first is to centralize coordination and tracking. As Councilmember Buscaino just asked about, there is data now available much cheaper. Both the city and county participate in open data programs. It didn't exist several years ago. It's much less expensive for a city health officer or kin position to actually track this stuff, so you all would have an ongoing dashboard that would enable some measure of, are the community health indicators responding favorably to the policy changes. So that's sort of one suggestion, is to formally instill a tracking program. Second, to acknowledge that about 80% of the folks that came in front of us that talked about different issues that fall under Plan for Healthy LA actually weren't aware. And that was remarkable to us, given the 3 years of work that went into putting it together. I think the step forward on all of that is perhaps for this committee or another setting to create a briefing for funders in the philanthropic community to outline these objectives the city has that are programmatic services that need money. That's sort of one bucket. Then the third bucket has to do with trying to centralize the city's health expertise for these planning and land use issues. This is a health and wellness element of the city's general plan. There are fascinating challenges regarding the combination of land uses, from oil extraction to the toxics in the environment, et cetera, that merit some specific health expertise, and Health Commission's happy to help think through what that looks like.
Thank you, Mr. Sharp, and that is why we are always in sync. We are completely in agreement, and we are working on those things. And seeing there's no more public comment, we will move to continue this item for another 180 days, so we can start receiving semi-annual updates on progress. And seeing no objections, we'll move that unanimously. And with no other business before us, this meeting is adjourned. And thank you to everyone who has attended.